Welcome to TechEd's Spirometry Preparation and Performance Training video. I'm Susan Blonshine, TechEd's President and CEO, registered respiratory therapist, registered pulmonary function technologist, and certified asthma educator. The mission of TechEd's Spirometry Preparation and Performance video, along with its accompanying documentation, is to enhance your knowledge and proficiency in the performance of spirometry according to the current American Thoracic Society recommendations, the European Respiratory Society, and the AARC clinical practice guidelines, ultimately leading to the production of valid test results for diagnostic evaluations. Spirometry is used in the diagnosis, assessment, and management of asthma, COPD, cystic fibrosis, and other respiratory and systemic diseases. It has proven to be cost-effective, and the relative ease with which it can be performed makes it a viable tool for an expansive patient population. Overall, consider spirometry as being a three-step process: pre-test, testing, and post-test. It then can be broken down still further, beginning with the pre-test stage, which is comprised of equipment preparation and patient introduction and instruction. The testing stage is the actual performance of the spirometry tests. And the final stage, post-test, involves your understanding of acceptability and repeatability as well as report generation. This video provides comprehensive coverage of the first two steps, pre-test and testing. Checking results for acceptability and repeatability and generating reports is discussed briefly as well. However, these aspects of spirometry are discussed in greater detail and length in TechEd's Spirometry Performance, Error Recognition, and Reporting video. Each topic is introduced, defined, and reviewed in separate units. You can go through the units at the best pace suited for your schedule, learning preferences, and special needs and interests. Then at the end of the video, we've included a quiz, a glossary of terms, suggested readings, which will support spirometry testing techniques and standards, and a catalog of related products and services that are available at TechEd. Additionally, please take advantage of the video's companion document available on the TechEd website, created specifically for use with the Spirometry Preparation and Performance Training video. The address is techedconsultants.com. This document, formatted as an Adobe Acrobat PDF, is comprised of the subject matter covered in the video. TechEd's Spirometry Performance, Error Recognition, and Reporting Training video is also available online and is a valuable teaching tool for persons new to spirometry, as well as technologists looking to refresh and or enhance their existing spirometry test performance skills. Upon completion of the Spirometry Preparation and Performance Training video, you should be able to recognize acceptable calibration to verify equipment performance, describe the steps in preparing an individual to perform a forced vital capacity maneuver, explain the procedure to the individual performing the test, perform a forced vital capacity maneuver adhering to ATS-ERS recommendations and the AARC clinical practice guidelines, recognize and report acceptable and repeatable forced vital capacity trials.
In this unit, we discuss equipment preparation and calibration. All testing sites should have a well-defined quality control program as recommended by the AARC and ATS-ERS. Also, you should be familiar with the Center for Disease Control's infection control recommendations and have the necessary infection control supplies on hand. Infection control guidelines and recommendations are defined online at www.cdc.gov. Gather the supplies required to perform spirometry with your equipment. Equipment required includes mouthpieces and nose clips. Depending on your equipment, You may also need disposable flow sensors or bacteria filters. If your equipment does use disposable flow sensors or bacteria filters, they must always be changed between patients. Your spirometry device may require additional equipment. Check the owner's manual for further details. Other supplies required may be, but are not limited to, a thermometer, a barometer, scales, and a tape measure. If the lab spirometer requires a warm-up period prior to use, turn it on before the patient arrives. Verify that the temperature in the room, sometimes referred to as the ambient temperature, is between 17 and 40 degrees centigrade or 63 to 104 degrees Fahrenheit. Maintaining this temperature helps to ensure proper equipment function. Enter environmental data into your equipment. This would include the temperature, relative humidity, and barometric pressure. These measurements must come from an accurate source, representative of the testing environment. Why are reliable, accurate tools for measuring the temperature, relative humidity, and barometric pressure important in spirometry testing? Each is required to convert volumes and flows from ambient temperature and pressure saturated, ATPS, to body temperature and pressure saturated, BTPS. At the start of each day of spirometry testing, verify proper equipment function by performing a calibration check using a 3-liter syringe. Additionally, calibration checks should be performed every 4 hours if large numbers of patients are to be tested, when flow sensors are changed between patients, if the temperature changes by more than 5 degrees Fahrenheit. The 3-liter syringe used for the performance verification should be stored close to the spirometer so that they are maintained under the same environmental conditions. This syringe should be accurate to 15 milliliters or 0.5%, whichever is greater. It should also be validated by an outside source every year. Contact your manufacturer for more information regarding equipment service and validation. When performing the calibration check, inject the 3-liter volume at 3 different flow rates, each between 0.5 and 12 liters per second. The importance of having an accurate calibration device should not be understated. According to the ATS-ERS, the measured value obtained during a calibration check should be within 3.5% of the syringe volume. An acceptable range for a 3-liter syringe is 2.895 to 3.105 liters. If any one of 3 calibration checks performed is outside the acceptable range, the calibration check overall fails. If the calibration check fails, try the following. Repeat the calibration check. Then, if it fails again, change the disposable parts, such as the flow sensor or bacteria filter. Then, attempt calibration again. If calibration continues to fail, contact your service technician. A final note regarding failed calibration. Never test patients using a system that fails calibration checks until its problems have been resolved and it has adequately passed subsequent calibration checks. When the equipment requires a warm-up period, turn it on before the patient arrives. Gather the supplies required for testing, including mouthpieces, nose clips, and, when applicable, disposable flow sensors and bacteria filters. Disposable flow sensors and/or bacteria filters must be changed between patients. Record temperature, relative humidity, and barometric pressure. Perform a calibration check using a 3-liter volume syringe each day of testing, and if the room temperature changes 5 or more degrees Fahrenheit.